Nursing care during labor. Labor is the series of events by which uterine contractions and abdominal pressure expel a fetus and placenta from the uterus. The purposes are the following: to individualize care to the women experiencing labor, to detect danger signs and prevent complication during labor, to safeguard maternal and fetal health, to make labor more effective, and to evaluate determinants of a successful labor. And for the indication, contractions, cervical dilation, increased vaginal secretions, nausea, vomiting, and anxiety. And for the contraindication, vasa previa, placenta previa, myomectomy with entry into uterine cavity, active genital herpes outbreak, umbilical cord prolapse, or transverse fetal lie. And for the equipments, sterile examination gloves, sterile lubricating solution, and aseptic solution. And for the Leopold's maneuver, systematic method of observation and palpation to determine fetal presentation and position and are done as part of physical examination. And the purpose is to determine fetal presentation and position and the expected location of the point of maximal intensity or PMI of the fetal heart rate in the woman's abdomen. The indication for pregnant women with palpable fetus usually performed starting from the middle of pregnancy, and for the contraindication, a full bladder may obscure the findings. Vaginal examination. It is necessary to determine the extent of cervical softening, effacement, and dilation, and to confirm the fetal presentation, position, and degree of descent. It is best done between contractions. The purposes are to prevent infection, check for normal vaginal dilation, determine the cervical readiness for labor, confirm fetal presentation, position, and degree of descent, and to detect early warnings. And for the indication, performance of artificial rupture of the membranes to induce labor. Contraindication, preterm and pre-labor rupture of the membranes without contractions. Upon admission, obtain vital signs including temperature, height, and weight to determine for any problems. Next is to obtain relevant data related to pregnant women such as LMP, age of gestation, and EDC. This data helps establish the viability of fetus. Next is to place client in a supine position with knees flexed and measure the fundic height to relax the abdomen and perform the Leopold's maneuver. Perform first maneuver. Stand at the foot of the client facing her and place both hands flat on the abdomen. Palpate the superior surface of the fundus. Determine the consistency, shape, and mobility. Next is to perform the second maneuver. Face on the client and place the palm of your hands on both sides of the abdomen. Palpate the sides of the uterus. Hold the left hand stationary on the left side of the uterus, while the right hand palpates the opposite side of the uterus from top to bottom. Next is to perform the third maneuver. Gently grasp the lower portion of the abdomen just above the symphysis pubis between the thumb and index finger and try to press the thumb and your index finger together. Determine any movement and whether the part is firm or soft. Next is to perform fourth maneuver. Place fingers on both sides of the uterus approximately 2 inches above the inguinal ligaments, pressing downward and inward to the direction of the birth canal. Allow fingers to be carried downward. Next is to perform the vaginal examination. First is to wash hands for infection prevention measures. Explain the procedure to the client to gain consent and cooperation, and provide privacy. Assess client status and plan to meet individual client need to serve as a baseline data before examination and prepare all needed equipment. Next is to ask the woman to turn onto back with knees flexed, dorsal recumbent position to access the vulva to be examined. Then repeat hand washing and put on sterile examination gloves. Using of sterile gloves prevents contamination of birth canal. For prepping and draping, pour antiseptic solution over vulva using the non-dominant hand. Take a fresh sponge to begin each new area and do not return to a clean with the used sponge. Use a zigzag motion from clitoris to lower abdomen just above the pubic hairline. Use a zigzag motion on the inner thigh from the labia majora to about halfway between the hip and the knee. Repeat for the other inner thigh. Apply a single stroke on one side from the clitoris over labia, perineum, and anus. Repeat for the other side. Use a single stroke in the middle from the clitoris over the vulva and the perineum. One direction strokes prevent the spreading of microorganisms from one area to another. Then discard 1 drop of clean lubricating solution and drop an ample supply on tips of gloved fingers. Place non-dominant hand on the outer edges of the woman's vulva and spread her labia while inspecting the external genitalia for lesions. Look for red, irritated mucous membranes, open, ulcerated sores, clustered and pinpoint vesicles. And look for escaping fluid or presence for umbilical cord or bleeding. If there is no bleeding or cord visible, introduce your pointer and middle finger of dominant hand gently into the vagina, directing them toward the posterior vaginal wall. Touch the cervix with your glove examining fingers. Palpate for cervical consistency and rate it if firm or soft. If it is firm, it feels similar to the tip of the nose. If it is soft, it feels pliable as earlobe. Then measure the extent of dilation. Palpate for an anterior rim or lip of cervix. Then estimate the degree of effacement and estimate whether membranes are intact. Then locate the ischial spines, then establish the fetal positioning. Withdraw your hand slowly and wipe the perineum front to back to remove secretions or examining solution. Then leave client comfortable. Document procedure and assessment findings and how client tolerated procedures.